Good afternoon. I am Betzabel Estudillo, Chief Engagement Officer with Nourish, California. And this session is on creating effective partnerships at every level. We are joined by a number of panelists who have diverse expertise and skills in improving access to CalFresh. This session is going to focus on how we create those effective partnerships at the city, at the county, and at the state and federal level to increase our CalFresh participation, to ensure that our Californians have a better experience when accessing CalFresh. Before we get started, I did want to share a couple of numbers with you all. If you haven't already looked at our report that we just published maybe a month ago, maybe a little more than a month ago, called Lost Dollars, Empty Plates, that says that there are approximately 2.7 million Californians that are eligible for CalFresh but are not enrolled. And so what that means and how that translates to dollars is that California is leaving about $3.5 billion in CalFresh dollars. And those are dollars that we can certainly maximize and provide those food benefits to Californians with low income. So, like I said, we are joined by a number of panelists. I'm going to quickly introduce them, but I'm going to ask them a question so you get to know them a little bit more. To my left, we have Jasmine, I'm not mispronouncing, Marquardt?
Marquardt, that's perfect.
Okay, perfect. She's the Assistant Director with the Senior Network Services. We also have Gabby Davidson, Policy Advocate with the California Association of Food Banks. And then we have Karina Apodaca, who's the Program Manager for the Center for Healthy Communities in CSU Chico. So can we give them a round of applause? Thank you. Great. Well, welcome. So like I said, I'm gonna get started with a very easy question because I want the participants to get to know you all. But can you, and we can go from here to the end, but can you share your name, what you do at your respective organization, and how you came to do the work you do?
Sure. Hey everyone, thank you so much. Oh, sorry, I forgot about this. Thanks so much for joining our session. Really grateful to be able to share some experience from the older adult perspective. My name is Jasmine, like she said, Assistant Director with Senior Network Services in Santa Cruz County. We serve about 12,000, well, we've been in Santa Cruz County for over 50 years, and we've served over 12,000 aging adults. I come from USC. I have a master's in social work, and so for about the last decade, I've been working with older adults, primarily in case management, with those individuals or populations who were homeless or at risk for losing housing, those with healthcare, physical and mental health issues, and socioeconomic issues. So that's kind of how I've had some lived experience working with social workers in my younger days, and it just got me very intrigued in taking my studies for my bachelor's degree in psychology, transitioning to social work. So I really love the fact that it examines an individual beyond just the physical and mental components and looking at the social determinants of what can help a person thrive independently. So just a quick blurb about what we do, is that okay? So at Senior Network, our mission is to provide case management services with regards to healthcare and housing for aging adults on a fixed income who are at risk for chronic illness, institutionalization, homelessness, and for resource equity to things like food resources and utilities, for example. Yeah, so that's just in a nutshell what we do over in Santa Cruz. Thanks.
Hey everyone, my name is Gabby Davidson. I am a policy advocate at the California Association of Food Banks, and I got involved in the anti-hunger space when, through word of mouth, I actually heard about the CalFresh program in college. I remember applying for the program and studying for the interview as if it was a job interview because I had no idea what to expect. And so just that experience of navigating the application process and also receiving the benefits and seeing how beneficial they were inspired me to become a CalFresh outreach worker actually in Santa Cruz County, where I was able to help people apply, but I also unfortunately saw that a lot of people couldn't get the benefits. You know, a lot of immigrants couldn't get the benefits and a lot of students, because of those additional rules, couldn't get the benefits. And so just seeing the, inequity in who had access to the program and seeing how inadequate the benefits could be really inspired me to get involved in policy. You know, hunger is a policy choice, and so I'm really thankful to work alongside my colleagues at CAFB, the California Association of Food Banks, where we work to end hunger in California through legislative or bills, through budgetary advocacy, and also administrative advocacy. So that's, looking at how bills or policies are being implemented. And I primarily focus on advocacy and policy at the state and the federal level.
Switching it by rolling the focus on the barrel. Yeah.
All right,
It's just a
so my name
technical
is
phrase.
Karina, Apodaca. I am from the Center for Health and
Can
Community
switch
at
over
Chico
now.
State, and I am currently the Community Outreach Coordinator there. And so we serve multiple populations around our communities in the North State. And we do CalFresh application assistance for anyone who's potentially eligible for the program. We do build partnerships in many local organizations, but we also specialize in one very unique partnership, which is the California Department of Corrections and Rehabilitation, assisting those who were formerly incarcerated. But our agency does a lot, not just outreach and stuff like that, but nutrition education. We have a team at the farmers market doing the market match program, and we have a team who specializes working with college students. So we do a lot, but what I do is just a small little bit of it. So, yeah.
Thank you so much, Karina. So a couple things that I forgot to mention before we can continue the conversation is that we will have a conversation with our panelists. I have a number of questions that I will be asking. I'm sure questions will come up as you're hearing them speak and share. So I really suggest you take notes in that beautiful blue notebook that we provided you, or your own notebook. And we will have a Q&A section at the end. Our wonderful colleague, Jackie Mendelson, is actually going to be helping us with passing the mic so that if you have a question, she'll be able to give you that mic so we can all hear you. This is also being recorded and live streamed as well, so just know that this is why we have a camera. We won't be taking questions from the folks on the Zoom, but they are watching us, so hello. Hope you enjoy this conversation as well. Okay, so maybe to kick things off, I am talking about partnerships, right, and creating those effective collaborations. I wanted to ask any of you, whoever wants to get started, can you share how you have created and strengthened partnerships to improve access to CalFresh?
Sure, I'll just go in order so that that's okay. I wanted to just present to you guys how unique access to CalFresh benefits some of the challenges that seniors face. It's very unique to their population versus some of the other wonderful discussions we've had earlier. But as the cost of living continues to rise, so are the costs of life-saving resources that seniors are expected to pay full price for, while they're now living on a fixed income relative to what they may be used to when they were employed before they retired, for example. So things like housing, utilities, food resources, and healthcare are real financial struggles for seniors to navigate through. So as we all know, as the baby boomer population turns 65 between now and 2030, there's going to be a huge increase in the amount of seniors that we see in our society, and more so than those who are enrolling in kindergarten, which I found pretty interesting. So as the number of seniors rises, so are the amount of people, senior aging adults that are going to have physical, mental, social, and economic challenges. Let's see. And then just a fun fact, I don't know if most of you folks are aware or not, but also as their Social Security benefits or their retirement benefits rise annually, even by just a couple dollars, it causes a drastic reduction in their CalFresh benefits. So, and I'll speak a little more on that later, but as far as partnerships or fostering partnerships, we do this through many different avenues. We try to make it as easy as possible for the seniors we work with. A lot of them are dealing with technological, lack of being able to navigate technology. A lot of common issues we see are also lack of transportation. So as adults age, they do lose their ability to drive, for example. And even if they're connected to transportation resources, their physical mobility may limit them to, stand and wait for long hold times for these rides. And then cognitively, it may be difficult just to get through the process of the applications in general because of memory issues or other cognitive limitations to their capacity they may face. So to address these common barriers, we typically will do applications over the phone with seniors, and then because the majority of them are homebound, so it makes it really difficult for them to go to Social Security and sit for hours for an appointment to process an application. We do use the online portal when we do these phone appointments. We also do we also do quite often go to the client's home and meet them face to face and process those applications. We're also contracted with the county to assist APS and IHSS with some really critical cases that may come across. And then we do a lot of community outreach, so we go to low-income or affordable housing complexes in the county, senior centers, and different community organizations in the county or nonprofits, and so we do a lot of presentations there to educate them on the senior population. We do a monthly advertisement in the newspaper. We always write articles. We have social media, and then so that's about the ways that we're involved in helping seniors access the CalFresh benefits.
Yeah, so I would say the way that CFB and I help strengthen partnerships to improve CalFresh is really, through collaboration and capacity building and communication. And, we know that we can't end hunger alone. I can't end hunger on my own. CFB as an organization can't. And so it's really about working in coalition. That's one of my favorite parts of my job. I can give an example of what this looks like when I'm working on legislative advocacy. So for instance, as you heard from Kat earlier today, there's been a movement to try to increase the CalFresh minimum to $50 a month. And last year there was a bill that was moving, SB 600 by Senator Menchavar, that CFB worked on in partnership with Nourish, California, Hunger Action LA, and End Child Poverty. And so as co-sponsors, we partnered together to work on that advocacy. But we didn't do that alone. There was over 70 organizations that got involved in the movement in ways that they had capacity to. So that may have looked like signing on to a support letter, or attending a hearing to give public comment, or sharing a story about how increasing the minimum would be important for them or the people that they work with. And I think one thing that shows how strong that partnership is, it was a coalition priority for a few different coalitions, like the California Hunger Action Coalition and the California Food and Farming Network Coalition. And when the governor a few weeks ago said that he wants to propose to cut the pilot, within a few days, over 70 organizations on our sign-on letter signed on to say that, we want to make sure that this program is not cut. and I know that it was a big priority in the disability rights community as well, and they submitted a letter on, you know, what they wanted to reject or support in the May Revise, and that included making sure that there's no cuts to the CalFresh minimum pilot. So I would say, you know, that's some of the ways that we partner with people at the state level, but we also partner with people at the federal level. Just yesterday, I was in a meeting with people who are working on trying to increase the SNAP or the CalFresh minimum in their state, and it was an opportunity for me to share, you know, lessons that I've learned and best practices, and also learn from them as well. So the work that we're doing, you know, has an impact on other states as well. I know we were inspired by the work that New Jersey and New York is doing, and so we can help and learn from each other that way.
I would say ways that I've created and maintained partnerships would be, of course, like Abby said, communication is key. I also attend a lot of the outreach events that I help plan with partnerships. And so I like to call myself the little social butterfly at events, because I go to every table and I meet every single agency that's there and try to figure out where our agency fits in with them and how we can best work together to figure out if we can serve their population with the work that we do. And so I would also say that continuing to stay in touch with partnerships is very important. So we have partners that we partner with maybe once or twice a month through virtual meetings, but we also have partners that we only see maybe once a year. So staying in touch, maybe revisiting a partner that you've seen from last year to be like, hey, we met last year, do you have any events coming up this year? We'd love to be part of it. So of course, stay in touch.
Great, thank you so much. You know, what I've been certainly hearing is that, one, we can't do this alone, right? We need partnerships, coalitions, networks, partnerships with community organizations, with promotoras, with the departments. It really takes a whole team to ensure that people have the information they need to learn more about CalFresh, to access it, to have a better experience. So certainly, you know, those are all needed. And I think as we're continuing this conversation, I think I challenge everyone as well to meet someone new, you know, that you haven't. Sit at another table. I know everyone feels comfortable with your team and, you know, meeting. I certainly, I know I was in the back talking to my team, but like really challenge yourself to meet other folks and see what you may have in common, what partnerships you can probably engage in. So, you know, we'll get a break later, so that's maybe a little homework for later. So thank you everybody for sharing. You know, one of the things that is really top of mind for me is that I think as we talk about partnerships, we certainly talk about the agencies and community organizations and all of our partners, but we also need to think about our community members who are also our partners. And I know that many of you do work with community members directly in providing services and providing opportunities for engagement. But I'm wondering if maybe you all can speak a little bit more about how, in your day-to-day work, how do you ensure there is community input or engagement in your efforts to improve access to CalFresh? And maybe we can start, we'll start on that side to give you some, yeah, go ahead first.
I would say education, constantly keeping the community educated on, you know, things that change, even just the minimum amount for CalFresh, the gross monthly income, maybe letting them know that it's gone up. Really letting them know that it's important for each one of them also to share their stories, to let us know how we can better help them, because that's the only way we're going to make change, is if we hear from them. So knowing that their voice has an impact. So
yeah, kind of going off of the education piece, I think it's important to let people know like how they can get involved. So from my perspective, mainly working on advocacy, and we have a page on our website that says how to get involved in advocacy. And it's something that I revamped a few months ago because a library was saying that they use it as a resource. And on that website, we have information on how to vote, because that's a really important part in getting involved. We have information on, how to join different coalitions. For instance, I help co-lead the Californians for SSI coalition, which helps to ensure that people who receive supplemental security income can live in dignity, and we know that hunger and poverty are connected, and by increasing those grant levels, we're reducing hunger as well. And so we have information on how to get involved in that coalition as well as a few others. And then also just information about, where to learn more. So we have a connection to Nourish, California, and a few other, anti-hunger and anti-poverty websites. So that's just one way. And then I think also just letting people know about other ways to get involved, on the ground. If they are interested in sharing their story and talking to a legislator, we work in coalition at the California Hunger Action Coalition to put on a Hunger Action Day every year. And major shout out to Jackie from Nourish, California, who led that effort this year. And every, late April or May, it's an opportunity for community members, no matter how much or how little advocacy you have, experience you have, to get together, to come to Sacramento, to let legislators know what you want to see prioritized. And in partnership with a lot of other organizations, we, help to ensure that there's transportation to that event. We host an advocacy 101 training before the event so people feel empowered to participate. We also had breakfast and lunch provided there as well. And then I think also going back to education, one thing that we do at CAFB is we host monthly CalFresh Advocates Call. And so it's a place for, advocates and CBOs to find up-to-date information about what's going on in the policy realm so that they can later share that with the community, but also bring up, what they're hearing from community members so that we can help address that. And one other place where we hear from community members is through the CalSAWS Advocates Group. And that's a coalition or a group that anyone can get involved in, including community members, to help share, what improvements that they would like to see on the Benefits Cal website. And it's a place where, you can attend user-centered design meetings monthly to see, does this design make sense on Benefits Cal, or what would I like to see, and provide your feedback on that as well.
Well, I don't know if I can top that, but that was really great. Without reiterating everything they said, but I agree on all the points they mentioned. We're also, we're just kind of dipping into policy advocacy as well. It's something kind of newer that of a project that I've been assigned to. So we were out in Sacramento recently for policy advocacy as well. And then this event would be my second one. We do participate in a lot of community events and resource fairs. We're in constant collaboration with other agencies, participating in committee meetings on the county level as representatives for seniors. So we're kind of the main hub for senior rights or Board for Senior Resource Equity in Santa Cruz. So we're the only ones, like for housing for support, for example, we're the only ones that are senior specific. But with regards to CalFresh, we're just always in collaboration with other agencies. We focus a lot on community outreach. So that's about.
Yeah, and I certainly see when you mentioned about community outreach, Karina also mentioned education and that need to be able to work with community, not just providing the services, but helping them learn and understand not just the program, but the systems and structures, right, of what they're experiencing. Why is it that they're struggling with, getting an interview, or why are they getting $23 for a CalFresh benefit, right? So these are all important to help them mobilize. And I just want to uplift what Gabby was saying in terms of the work around Chalk Hunger Action Day, the CalSAWS advocates groups, which are really good, and there's many others as well. Really good opportunities to bring community members to go to our Capitol and lobby and talk to their legislators about the issues that matter to them, and then also be able to actually provide feedback and input to our Benefits Cal platform that is, live and out, and we want to hear from community about like what's their experience, like what's working, what's not working, especially as we know that getcalfresh.org is going to sunset next year, and so we need lots of community input to that process. I'm going to ask another question because I know that creating partnerships doesn't always come easy. I know it's hard work, and so maybe I want to ask the panelists is there like a challenge or challenges that you all have faced in creating those partnerships, and also maybe like what have you learned from that and addressed them? There's two questions in there, so I'm happy to repeat it, but do you want to say?
Well, creating partnerships in addition to access to CalFresh benefits?
Yeah, so maybe a challenge that you have faced as you're creating partnerships, or maybe working with older adults.
Sure.
And then is there anything that you all have done to address them?
Okay, absolutely. So I'll start with some of the barriers and challenges that are pretty typical with our population. They may be things that, unless you're familiar with the day-to-day challenges of seniors, that might be quite surprising to you. So I mentioned earlier about, seniors living on fixed incomes, or typically on Social Security. They get an annual increase of about 3% per year. This could just be essentially a couple of dollars, but we can see up to a 90% reduction in benefit payments. So some typical benefit payment amounts we see are $19, $29, and $90. And then there seems to be no set mathematical equation on how this is determined. It's very confusing from our perspective as affairs representatives how these dollar amounts are determined. We can have two clients who have the exact same income and receive drastically different benefit payment amounts. One could be getting $19 and one could be getting over $200. And then I just wanted to present a couple of other common issues. So the system is just generally very difficult for seniors to navigate. On a daily basis, we see seniors coming in just overwhelmed by the mail they receive, incoming mail they receive from government agencies. They come with tears in their eyes, can you help me open this? Can you help me understand this document I received? The applications, the annual recertifications, they cause a great source of distress to this population. They're often technologically challenged. And like I mentioned earlier, there's issues cognitively or physically that prevents them from accessing the resources. And there's also an issue with EBT cards as well. So very common with this population to have some memory decline, so losing their EBT card is also a very common occurrence, and it can take several weeks to obtain a new card. So sitting on hold with with CalFresh can take up to hours for these clients, so they don't often have the capacity to or the strong enough health to be able to even participate in just a phone call, or sitting hours in social services. And let's see, just a couple of little ones, like for example, the limitation to being able to buy pet food with the CalFresh benefits. So seniors, one of the biggest challenges they face is isolation, mental illness, very typically depression due to loneliness and isolation. And lack of socialization. So the companion animals are a key component for a lot of our seniors that help them feel fulfilled. And so having access to pet food could be very beneficial to them. And then there's also the inability to buy vitamins and supplements with CalFresh benefits. I think that synthetic food would be very useful to them, as often they're dealing with chronic illness. And then hot food limitations. So it's often very, due to cognitive decline, it's very difficult for seniors to cook for themselves. It can be very dangerous. Can lead to gas fires, for example. So having access to pre-cooked foods that are hot foods could essentially really save lives with this population. And then lastly, a lot of this age group comes from the older times where they considered CalFresh benefits as food stamps, and they would go in with these coupon booklets to the store, and it was very, very a showcase that they were using assistance or government assistance. And so they're probably a primary population that still leans on the stigma that's associated with CalFresh benefits. We have a lot of seniors on low incomes who deny getting CalFresh benefits. They don't want to rob from other people's, other needy people. They don't necessarily see themselves as needy because they're used to living on a higher income, and that's been drastically reduced now. So they don't necessarily identify as someone of a low income status. There's a lot of shame and pride associated with this, with accepting the benefits. Oftentimes we describe them as being house or investment rich but cash poor. So they just identify differently than some of the other populations. So I don't know if I'm going over time, but just wanted to talk about one case in particular, just take me a minute, is that okay? So I have something that kind of illustrates everything that I've touched base on is there's a gentleman that we've been working with this past year who
What camera are we on right now?
he has kidney failure and a bone disease that requires him to
Yeah, can we get a close up real
run
quick?
his heater 24 hours a day. And as we know with the increase of cost of living and a lot of these resources
Is
like
one live
utilities
right
and
now?
food, we know that PG&E has significantly gone up, for example. So in his case, he's running a bill upwards of $500 or more per month.
Just a minor
And
framing adjustment, thank you.
He's also refusing to get CalFresh benefits, even though he more than qualifies, because he does feel shame associated. He is with accepting these benefits. So he's running the bill so high that about halfway through the month he runs out of money to buy food for himself. So his caregiver, we just found out, has been for several months paying out of pocket for the rest of his groceries. So this is a really common thing. You know, this story is something we see on a daily basis. And even for those who do have access to CalFresh benefits, like I mentioned, you know, a couple dollars in increase in Social Security can take their benefit payment amount from $280 down to $19. And it's confusing, it's distressing to the recipient. So yeah, these are just some barriers that hopefully will paint a little bit of a clearer picture from the perspective of aging adults. Thank you.
Yeah, so for CFB, the way that, or some of the challenges that, you know, I personally faced or seen is, you know, one might just be awareness. There's a lot of coalitions out there, there's a lot of bills out there, and so just kind of, you know, thinking about that challenge is people might want to get involved in the fight to improve access to CalFresh, but they might not know how. And so, you know, just one thing I think internally that we do a lot when we're onboarded is you might grab coffee with someone from a different, you know, from the communications team at your organization. But one thing that I really loved that I did at CFB was, you know, I had an introduction to other partners. And so I had an opportunity to learn about some of the work that they're doing and some of the work that they're leading. That way, you know, when there is, you know, turnover and when there's new people who are coming onto your organization, there's opportunities to still, you know, fill that gap so you are able to learn about what's going on in terms of advocacy. And then I know another challenge that I see is capacity. So, you know, everyone's really busy, especially, you know, May, I know it's CalFresh Awareness Month, the May Revise just came out. And so I think it's important to, you know, this came up in an earlier session, is have empathy for what people are going through. And this job can be emotionally taxing, and it can also, you know, just be a lot of work that you're doing every day. So I think it's important to be mindful of the boundaries that people have. They may not be able to get involved in everything, but one thing that we can do is help uplift each other's priorities. So for instance, not everyone has time to be in the Californians for SSI Coalition, but I've seen, you know, the CHOC, the California Hunger Action Coalition, and us at CFP, you know, we have their priorities on our policy agenda. So that's the way that you can support a cause even if you can't, you know, be joining the meetings every month. I think I'll just stop there. Yeah, thank you.
I think in regards to partnerships, I think some challenges we faced is maintaining our contact person for certain organizations. It can be 1 month we're working with someone and then 6 months later, I don't have a point of contact for that agency. So it's continuing to find the point person who's going to lead me in the right direction to maintain that partnership. So I think that's one of the challenges I've come across. Another one is, since we are in the North State, we're in a rural area, and so we're constantly traveling to surrounding counties to do application assistance, to be present at outreach events. And so we are a small team, so we have to have a team at the office doing client services to help those who are calling our office for assistance. But then we want to be at these events to be able to educate the community and find those individuals who are currently not on CalFresh, to see if there's potential eligibility. And of course, you know, having another team at the farmers market offering assistance with their CalFresh transactions in the market match. So I think that's another challenge too, is trying to be everywhere, but we can't always be everywhere. And I think from like a client challenge perspective, I think what's challenging for our team is getting clients who we help do the application process, go through all of the steps to get them to the benefits, but then realize they're only eligible for the minimum amount, and then having them be really upset that they went through this hard, lengthy application process to get the bare minimum. With food costs going up, they're upset. They're saying, I cannot afford $23 a month for food. And so that's where we kind of step in also to educate them on how they can double that money going to the farmer's market, getting fresh fruits and vegetables, and kind of, you know, educating on how they can better, you know, split that money within the month. So just a few challenges, but yeah.
Thank you, Karina. You mentioned that, the benefit amount, and I know we've talked about the CalFresh minimum benefit pilot, which also unfortunately was cut in the governor's May revise, but there's a lot of action happening, and so I'm going to turn it to Gabby, and there's about sort of, we're going to shift gears and sort of like what actions are happening, how can we get involved? So we know that CalFresh is our state's most powerful anti-hunger program. It actually keeps around 430,000 children out of poverty every year. However, we recognize there are barriers, as Karina and others have pointed, that are embedded into the system that make it really difficult for Californians to access benefits. So Gabby, I have a specific question for you. What are some opportunities at the federal level to ensure access to CalFresh?
Yeah, that's a great question, and something I enjoy a lot with our work is, you know, as we're working to improve access to CalFresh for immigrants and for college students and benefit adequacy at the state level, there's also a lot moving at the federal level to do this. So you may have heard about the Farm Bill, which is a piece of legislation that's typically authorized every 5 years. And a lot of it's happening right now. I know my colleague is listening to a Farm Bill, you know, hearing for Marquardt today. And you know what it does is it can change policies that influenced SNAP at the federal level or CalFresh in California. And so something that we've been doing at CFB along with our partners is letting members of Congress know what we want them to support, what bills we want them to support to help strengthen CalFresh. And so one of the bills is the EATS Act, which would improve access to SNAP or CalFresh for college students. And so we've been asking members of Congress to sign on to that. Another one is the Improve Access to SNAP Act, or the Improve Access to Nutrition Act. And that would get rid of the harmful ABOD rules that Kat mentioned earlier, since, you know, we know that waiver is going to end in California in October. So that's another one that we're really supporting. And Kat also mentioned that unfortunately there's been a lot of talk about cutting access to SNAP or cutting the program through the Thrifty Food Plan. About $30 billion in cuts is being proposed. And so about 70 partners just this month signed a letter of support that we sent out to our members of Congress, letting them know that we don't want to see any cuts to SNAP in the Farm Bill. We want to see access to CalFresh or SNAP improved and benefit adequacy improved. And so one of the other bills that we're asking people to support is the Closing the Meal Gap Act, which would improve benefit adequacy. So hopefully, people can get more than just $23 a month. And so I encourage all of you, if you're able to, see if your member of Congress is co-sponsoring these bills. You can, if you don't remember the names, that's okay. You can go to our Farm Bill webpage on our website. And if they're not co-sponsoring, ask them to co-sponsor and let them know why it's important.
Thank you so much, Gabby. Karina, right now, I'm going to talk about a little bit about our 1254 bill. So right now, people who are living in prisons and jails have no immediate access to our CalFresh program upon release, which puts them at risk for food security and other barriers. There is a bill that we are co-sponsoring with our partners at CSU Chico, Justice and Aging, and All of Us or None. If I'm missing anybody, let me know.
The Legal Services of Prisoners for Children.
Thank you so much, Karina. Which is authored by Senator Becker, and that bill will fix that issue and ensure that enrollment process begins, that people can get that benefit. It's already happening on the Medi-Cal side, so we want to make sure that's happening on the CalFresh side. The bill just passed the Senate floor earlier this week. Applause, because it is a huge hurdle right now, so it's going to be moving towards second house. And so I wanted to see if you can share, in talking about partnerships and all that, maybe you can share more about your experience working with CDCR, the California Department of Corrections and Rehabilitation, in advocating for this bill.
Yeah, so I, before COVID, I was attending the monthly community team meetings for probation, and I would meet with individuals who were on probation. It'd be a set of community partners who would go there, who would offer resources to these individuals. And then COVID hit, and unfortunately they shut that all down, but I had realized this is a population that could benefit from CalFresh benefits. And so I reached out to a director at the center. She helped me find a contact at Chico State who worked with CDCR, and kind of a conversation started about what we wanted to do. And it just started first with just a simple referral process. Parole agents would meet with their individuals, and then if they needed CalFresh assistance, they'd refer them to us. Once COVID started lifting, then they started having the in-person PACT meetings, which was then parole and community team meetings. So now I'm working with parole. And then we started attending those in person, where we'd sit down one-on-one with these individuals and help them apply right then and there. And so then I started, having conversations with Cameron from Nourish, California, and then we started talking about pre-release, how we wish, before they came out, they had these benefits, because when they come out, they only had gate money, which was about $200, which would probably pay for a bus ticket somewhere, and then maybe a one-night stay at a hotel. So we started talking about that, and that's kind of how we all worked together for this SB 1254. And so what I've come to find out is that most of these individuals that we were helping were likely eligible for the program and for the maximum benefit. So the gap we wanted to close was we were having caseworkers already going into the prisons and jails doing their Medi-Cal, so that when they came out, they already had their Medi-Cal, but we wanted that CalFresh as well. We wanted food benefits, and we wanted it as a package. And so I am truly happy and honored to be a part of this work, and just really excited to see where it goes, and hopefully it comes into law, but we'll see where it goes. So
Yeah, thank you so much, Karina. Jasmine, we've been talking a lot about older adults and their unique experiences. I just want to, before I ask you this question, I want to give some data, which I know you've also have shared. But according to a snapshot by Justice and Aging, by 2030, 10.8 million older adults in California will be over the age of 60. That will make up about 1/4 of the state's population. In addition, 33% of older adults aged 65 and older don't have enough income to meet their basic needs. So this is going to be a huge population as the boomer generation retires. And I think one thing you mentioned was there are going to be more older adults than kindergartens, right? Is that what you mentioned? Yeah. I'm sorry, when you said that, I think it really turned into perspective. I have a soon-to-be kindergartner later this year, so when you say that, I just felt like, wow, this is going to be a huge population and just a number of barriers. Maybe, I was wondering if you had like, I don't know, magic wand or a wish, is there something you would like to see change so that older adults can access CalFresh much easier? In all the challenges that you have laid out, is there one thing or two things that you think could change to make it easier for them to access CalFresh?
Sure. Before I address that, I just wanted to add something that while they're working on a larger scale, I just wanted to address that, we're working behind the scenes as case managers and advocates for seniors on an individual level to make the benefit payment amounts stretch until certain things are resolved or corrected. We're working hard to connect seniors to cost-saving resources, including utility discounts. We're helping assist with that process, application process, and getting connected to those services. For example, like if for Medi-Cal recipients, there's a lot of additional food programs that we try to link clients to. They're called medically tailored meals, and they're often to address some kind of chronic illness, and they're temporary. But we can get up to 26 weeks with most of these programs, and so we just hop programs and we try to make it stretch throughout the year. There's weekly food box deliveries, there's congregated meal sites, churches, food banks, Meals on Wheels, so there's different and then in-house we have volunteers that help with cooking and grocery shopping. There's another sister program, a senior companion program, where we link seniors to those who need companionship to help with things like that. So basically my point is that we're trying to assist them in reducing their expenses so that they can make their money stretch further to provide themselves with the food resources they need and to make their benefit and payment amounts stretch. But if I had like a magic wand, I guess the first thing that pops to my mind is I would love it if there was some sort of math equation that we could do, or basically, whatever a senior's income once was, and if it's being reduced when they're now living on a fixed income, perhaps their social responsibility to pay for utilities, but life-saving resources like utilities and housing costs and food resources, perhaps those costs can be adjusted as well to be income-based. So based on the amount of monthly income they're getting, they pay a reduced percentage towards these life-saving costs. So that would be one wish that I would have. And of course, in addition to with the rising increase in food prices, larger benefit payment amounts, especially when you said that there's so much untapped funding, and knowing that money's just sitting there, it hurts to think that there's some seniors expected to utilize $19 a month. So when there's so many people who currently have the benefits that they could use more help.
Absolutely.
So, yeah. Thank you for listening.
Absolutely. And I don't think we need a magic wand to make that policy change happen. This is why there's organizations here on the panel, in the room, to start thinking, especially as we head into the end of this year and the next year, about what policy changes we want to see. So we will certainly invite you to this conversation. So, okay, at this point, I'm going to turn it over to you all and as our audience to see if there's any questions that you have for our panelists. And again, we have Jackie here who's gonna pass the mic as well.
You want me to do it? Other side.
Got it. No, I'm just kidding. Great panel. Thank you so much for your feedback and just some of the stories you told were fantastic. I wonder if you could talk about like one example of a partnership that you got really excited about, because I know you're doing a lot of work. You're out in the community. This is over and over again. Can you just give like one example piece of something that you just got really, really excited about?
I would say all my partnerships, but I think working really closely with the Hispanic Resource Council is dear to my heart, just because, you know, wanting the food for all to go through too, and, you know, the population who has always been hesitant to even apply if they are eligible or their children are eligible. It takes a lot of dedication and a lot of building of trust with that specific population as well. But I think another really important partnership was the California Department of Corrections, since that population is very overlooked. I think that one's been one of my special ones as well. So.
Yeah, I agree. It's hard to pick. I think, you know, I really think about coalitions, and so one coalition that I really enjoy participating in is the California Hunger Action Coalition. And you know, it was only a few weeks ago that we had our Hunger Action Day, and that was my first time attending, and so it was really great to meet other people, both, you know, working at different organizations and also community members that were passionate about different legislative and budgetary priorities to improve access to CalFresh and some of our other priorities like school meals as well.
Oh, I already mentioned this, but I was really proud to be involved in the contract and the partnership we had with Santa Cruz County to be able to step in urgent cases like that are coming through APS and in-home support services to be able to step in for someone who's in a severe need for the resources, and even just something as simple as processing an application for someone who's just completely unable to advocate for themselves. So it was a really special partnership I felt to be involved in.
I'm gonna say +1 on chalk, Gabby. Definitely not a love for chalk.
Thank you. My question is, when it comes to CBOs, what strategies do you suggest for connecting to under-resourced communities? Possibly building that bridge to CalFresh, and this is coming from me. I work for an environmentally focused CBO who also advocates for like plant-forward, sustainable food systems and food justice.
And so just to make sure I understood your question, so it's how can CBOs connect with other partners in their area to improve access to CalFresh? Yeah. So I'm just speaking, you know, more from my experience prior as a CalFresh outreach worker. I think one of the things that worked well was seeing, you know, what other resources do people need? Like you were mentioning older adults, it's not only hunger that they're facing, but, you know, they might have subsidized housing, and they might be using all these other resources in your organization. So finding ways to connect with clinics or affordable housing units to, you know, have a pop-up tent and help people enroll in CalFresh could work really well. I remember I was helping one person in a senior housing facility apply for CalFresh, and she qualified, and that made me think, well, if she qualifies and she lives in the senior housing facility, probably a lot of other people do. And so we ended up having a partnership where we would go and do CalFresh outreach there once a month. It was right before COVID hit, but, you know, it lasted for a while.
Yeah, I'll back off that. We oftentimes, so when we do outreach to the community, one of our biggest resources is property management groups. So like when we work with senior housing complexes, creating a strong relationship with property managers, where we are welcome to go out and do presentations, every few months to certain or to the residents. So that's one way where definitely we reach out to hospitals, housing authority, and other county entities to just educate them on the program that we provide for the community. So a little over a year ago, we inherited a program, or we contracted with Medi-Cal to provide enhanced care management support services. So taking traditional case management with an emphasis on social determinants of health. So we just really want to make sure that healthcare providers and other institutions are have the psychoeducation around how important not just treating chronic illness or mental health issues, but also anything in an aging adult's external world that would help them improve their health and their independence. So even something things they may not have considered before, like access to food, that could drastically either improve or decline someone's health. So just making sure that a lot of the healthcare providers and community support providers that assist seniors are also aware of some of these other factors that affect their lives. So just constant outreach, creating relationships, presentations, meeting with the higher ups in any of these agencies we can. And I would say that's about it.
Thank you.
I was just going to add, I think it's really important too to maybe try to build a connection with an agency you don't really think you probably could benefit from that partnership, because you may think, oh, someone is doing outreach, assisting, I don't know, a certain population that you didn't think could potentially be eligible for CalFresh, but then you come and find out that they probably are. So that's kind of piggyback of what Gabby said. We've, met with different resident managers, and they're like, oh, they may be over income, but then when we get there, we realize we could probably work with figuring out the maximum Medi-Cal expenses that they have to bring them down to actually hopefully get them to be approved for CalFresh. So I guess every little outreach really makes a difference. So.
Thank you. Okay.
Am I on? Oh, yes I am. Beth Smoker with the California Food and Farming Network, and I do a lot of state advocacy work. And a number of you mentioned getting community members involved in advocacy, like calls to action, ways to do that on your websites. And I'm curious how you grapple with, in years like this when we have a budget deficit and things that we won last year and then get delayed and taken away, and just the populations we're talking about are populations that have been so harmed by government, and now this is like a repeat of that, or maybe reconfirming, like, gosh, government isn't working for me. And so just how do you grapple with that, and then how do you navigate through that?
Yeah, that's a great question, and I think, one of the things that I think about in a tough year like this is going back to, how hunger is caused by poverty, and, when there's cuts being proposed to all these food programs, but also to CalWorks, which is, one of our most low-income families and households, it's really important to think about, at the end of the day, a lot of us share the same goal of wanting to ensure that people can meet their basic needs. And so it's really being there for each other and ensuring that, when we have calls to action to protect CalFresh, we're also, having calls to action to protect CalWorks, because it is the same families that are being impacted. And also, I'm pretty new to this, and I think it's inspiring to see people who have been doing this work for a long time, and just remembering it is a long game, and, being able to educate legislators in your community about what the need is on the ground and why this work is so important is making a difference, because you're letting legislators know that, again, hunger is a policy choice, and when there's opportunities, we need to make sure that we're taking action when we can.
I'll just add to that a senior-specific issue that I didn't touch on earlier is so dealing with, like you mentioned, budget deficits. Something that we're seeing that greatly impacts our seniors is a shortage of caregivers, either through Medi-Cal services or through IHSS under Medi-Cal or Medicare recipients who are paying out of pocket. And you may wonder why I'm bringing caregivers up is because, one way that seniors can fully utilize their CalFresh benefits who are unable to, let's say, go grocery shopping for themselves or even use their benefits card, they would rely on a caregiver, for example. But with a shortage of caregivers, we have a lot of seniors who are just sitting there for months waiting for a caregiver. So that directly affects the person that would go do the grocery shopping or do the cooking for them or even bring the groceries in their home and just overall anything food related that they get support with. So we've developed some really creative programs in-house. Like we have a seniors giving to seniors fund to make up for some of the budget deficit towards caregiving, for example, where seniors have donated we have a pot of money that they've donated to help other seniors out. We have in-house volunteers. And we have a caregiver respite registry, so we have our own registry of caregivers that's at a reduced cost. It's significantly lower than you would find in private in-home care agencies. So we try to connect seniors to caregivers through our registry. And we also have a grant program that we provide grants to like family members caring for recipients who may need a break or they're not unable to care for their family member for a period of time, and we're able to step in and align them with caregiving services, or pay them back for any services they may have had to pay out of pocket, or pay for any future caregiving they might need. So we provide grants upwards of $2,000. So we're trying to work on creative ways that we can work around system gaps, basically.
Thank you. And I will say this is such a great question. I do want us to continue having this discussion because I know that unfortunately this is a really tough budget year. We're being faced with a lot of major cuts. It is expected, or I think there's a conversation that may also be the case for next year. So I do want us to, as advocates and as folks in the community, to really think about how do we get, continue to mobilize our communities into this advocacy, reminding them that this is a long fight, and that more than ever we need more actions and advocacy. I know it can feel very demoralizing. I certainly feel that as a long-term advocate, and so I need that reminder as well. But just how do we continue and re-energize and remind us of all the impacts to communities that those budget cuts are not just dollars. It impacts real people, as I know Jasmine has mentioned, what it means to have less caretakers, what it means to have less services for seniors. So anyway, I'm not going into a whole rant, right? But I think we all get it as well. So I would say this is, we're ending our session. I know the other sessions are wrapping up and they're going to be joining us soon. I know I gave a little homework, so reminder to please, as you're taking a small break, meet someone new, build a connection, a potential partnership as you're getting your snacks or your drinks. I really challenge you to do that. Can I get a round of applause for our panelists? Thank you so much, Jasmine, Gabby, Karina. Appreciate you all so much for taking the time. Thanks.